Hi, my name is Kurt MUNOZ, physical therapist here at Balance Physical Therapy. Here today to give you a little tip on ACL injury prevention. So here are 3 quick tips. Tip number 1, make sure you warm up and stretch before exercising or competing in a game. So that can be something as simple as doing exercise movements that would simulate what you're going to be doing in your workout or your game. So if you're going to be squatting and lifting heavy weights in a squat, do some body weight squats. In terms of stretching, make sure that you're stretching both in front of the knee and in back of the knee. So that'd be your hamstrings, your quads, making sure that joint has full range of motion and is ready to exercise or play in your sport. Tip number 2, make sure you're strengthening the muscles of your lower leg. So that would be the front of your thigh, those would be your quads, the back of the leg, those would be your hamstrings, but also don't neglect your hip muscles, those would be your gluteal muscles, and the muscles in your lower foot or leg that help to stabilize the knee. Those are often overlooked. So something simple for the glute muscles would be something like a side-lying clamshell, something like a side-lying straight leg hip abduction exercise. But we can also work on squats, things like that to help with the quads and the glutes and help keep that knee nice and strong. Tip number 3, don't forget balance. Balance is important. A lot of times we have injuries because we're unsteady, we're maybe not quite as balanced when we're jumping and landing. So some of the things you can do to work on balance is work on single leg balance. Stand on one leg, make sure you have appropriate balance. We generally say make sure that you can stand for 30 seconds without a lot of swaying or wobbling. Then from there, progress up. Try it on an uneven surface, maybe a piece of foam. From there, I would lastly suggest that we try to shift our weight and then balance, because a lot of activities that we do require lateral movements, changing directions, and so that way you can shift, balance on that leg, and make sure you're good to go when that knee and that ACL stays injury-free. Thank you very much.